Have you ever wondered what could be living right under your scalp that you don't even know about? I am Dr. Late Life. After 20 years of facing life and death, I thought I had seen everything. But then a fateful night shift made me reconsider. That medicine is still not prepared enough for what lurks in the shadows. Before I tell you, please subscribe to Dr. Late Life, because I'm not just telling true stories, but life-saving warnings. You won't want to miss out, especially when they could save your life. Make sure you're ready, because from here, there's no turning back. That night it rained cats and dogs. The hospital was as quiet as a graveyard. I'm on duty in the intensive care unit, where all that's left are the sounds of ventilators and the faint beats of weak hearts. A call rang out. Bicycle accident. A homeless man was brought in, unconscious, with a complex leg fracture. We received it as we have many times before, but as they placed him on the operating table, a CRNA nurse, eyes wide, face devoid of a single drop of blood, whispered in my ear, "Doctor, his hair is moving." I frowned. Move? I think it's a cramp, a muscle reflex. But when I placed my hand on the patient's head, my heart stopped. There's movement. Very light. But it's true. Small tremors, as if a swarm of worms were crawling right under the scalp. "Prepare the operating room immediately," I ordered. While the entire team was setting up for the leg surgery, I requested gloves and a scalpel. I'll check the beginning. A thin incision was made on the patient's scalp. A little blood came out, and then the smell of rotten meat mixed with dampness. And then something horrifying erupted from beneath the skin. Maggots. The plump, milky white maggots writhed as if awakened from a deep sleep. They crawled out of every crack, clung to my gloves, fell to the floor, and crawled into the surgical instruments. A nurse collapsed. A young doctor vomited into their mask. I stood still, trying to stay calm. This was no longer a surgery. This was an invasion. His scalp was no longer human skin. It was a nest. A large, damp, gloomy nest, where hundreds of creatures were growing. I extended the incision, seeing the entire layer of tissue perforated as if corroded. There were bite marks, cocoons, even unhatched eggs. We used forceps, clamps, suction, removing them one by one. Some were eating living skin tissue. Some had been dead for a long time, but their bodies still smelled. Still, I looked closer. On the top of his head was a small scar, almost gone. Surely an old injury. Perhaps he had hit his head, tearing the skin, and then it healed on its own. During that time, a fly, just one, laid eggs there. And then, week after week, month after month, year after year, its offspring multiplied, silently. No one knew. No one cared. I ordered a brain scan. Fortunately, no maggots had penetrated the skull. But if left for a few more weeks, that was entirely possible. And then, there would be no one left to save. The surgery lasted more than 4 hours. My hands were exhausted, but my mind would not allow me to stop. I had witnessed cancer eating through lungs. I had seen patients die from hemorrhage, but never had I seen a parasite living inside a person so quietly, persistently, and horrifically. After cleaning the entire head area, we closed the incision. The anesthesia team reported he would wake up in a few hours. I stepped out of the room, looking at the rain outside the glass door. I could still hear the sound of maggots falling onto the floor ringing in my ears. When the patient woke up, I went to him. "Do you remember anything about the accident, or before that? Have you ever had a head injury?" He looked at me, his eyes empty, drowsy. "I once fell down the stairs, hit my head on the wall, but I didn't go to the hospital. Thought it was just a minor scratch." I swallowed. "You know, Something lived inside you, under your scalp. We removed it, but you need further checkups. He nodded, not surprised, not afraid, just used to being abandoned by his own body. I returned to the office, said nothing to anyone, but that night I couldn't sleep. I scratched my head. I checked every old scar on my skin. I thought of all those people out there, homeless, uncared for, with no one to check their health. And then I wondered, how many creatures are living inside humans simply because we neglect ourselves? Did you know the human brain has no pain-sensing nerves? If a maggot burrows in, you won't feel a thing. No pain, no itch, until you start forgetting things. Headaches, insomnia, and then you're no longer yourself. Maggots, they symbolize apathy, a brutal reminder that our bodies, if neglected, become territory for death. If you've ever had a wound that wouldn't heal, if you've ever noticed a strange odor from your body, if you've ever suffered prolonged headaches without reason, don't ignore it. I'm Dr. Late Life. I'm not telling you this to scare you. I'm telling you so you survive. Subscribe to my channel, because the next story might be what you need to save yourself, or at least know how to run before it's too late.